Hi guys, welcome back to Visual channel. So this is the second video of surgery series, and today we will be discussing about the tenets of Halsted. So we have just mentioned the tenets of Halsted in the previous video, but we will be going into more details of the tenets of Halsted in this video. So subscribe this channel and hit the bell button for more updates. So moving to the introductory part, what is tenets of Halsted, or what are tenets of Halsted? So simply, these are some principles for better surgery and better recovery and better wound healing. So tenets means it's like a principle, a belief, or a doctrine that would help us to create a true history. So Halsted is a scientist, William Stewart Halsted, and he has described certain essential doctrines or principles for wound healing. These are known as tenets of Halsted. So moving to the tenets of Halsted. So the first one is gentle handling of tissues to avoid unnecessary trauma. Second one is aseptic procedures to control infection. Third one is anatomical dissection of tissues with sharp instruments. Avoid damage to major blood vessels and nerves. Fourth one is control hemorrhage with fine, non-irritating suture material in small quantities. Fifth one is obliteration of dead space to avoid accumulation of blood and exudates, which favors pus formation. Sixth one is use of minimum suture material. Seventh one is avoidance of suture tension. Eighth one is immobilization. Give rest to the operated part and to the patient. So you can see this is actually a mnemonic. You can see GAACOMTI. GAACOMTI. By this, you can remember the tenets of Halsted. Now moving to the tenets of Halsted. First one is gentle handling of tissues. The tissues which we are performing surgery should be handled very gently. Rough handling with the clamping of tissue forceps and all, they may cause additional trauma that may lead to poor healing. Second one is aseptic surgery. If at all we are maintaining a proper aseptic condition, secondary infection chance will be very less and surgery will be clean. Anatomical dissection. Whenever we are going to dissect during the time of surgery, we should actually have a proper detail or proper idea of the muscles, nerves, and vessels which we are going to cut. So, this knowledge will help us to properly dissect the body and do the surgery properly without having any amputations. Next is control of hemorrhage. Bleeding should be controlled at every stage during dissection because hypovolemic shock is a very big problem which we'll be facing during surgery. If the blood loss is very high means that may lead to hypovolemic shock. Next is obliteration of dead space. Whenever we are doing a surgery, there will be many dead spaces. And we should actually close all those dead spaces because if at all exudate or blood is going to that space, it will act as a culture medium for the bacteria and that may produce infection. Next is use of minimum quantity of suture material. Since suture material is a foreign body, our body will have action against those material. So to minimize that action, we should use minimum quantity of suture materials. Next is avoidance of suture tension. So whenever we are having sutures, so there will be very tight on the edges of the wound. So what happens? The blood flow or the blood supply to the edges get obstructed and that may cause delay in the healing process. The blood should go to that space actively and they should heal that space. So if at all there is very tight suture means the blood flow will be reduced and this would even lead to local necrosis of the area and tissue necrosis. Next is immobilization. That is, we should immobilize that area or prevent excessive movement of the wounded area because for healing to take place normally, it needs some time. So during the post-surgical period, if you are moving uh, unrestrictedly means that would create some problems in those adhesive tapes, the bandages and all. So that would delays the healing. That would delay actually the healing. So immobilization is very much needed. That is mainly actually performed by sutures adhesive tapes, bandages, plaster casts, etc. So, moving to the summary, these are Halsted principles of surgical techniques. We should actually go for GAACOMTI. Thank you.